Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm chatting today with Dr. Karen D'Appolito about her upcoming presentation for Gold Perinatal 2016 titled Care and Management of Infants with Neonatal Abstinence Syndrome. So Karen, thank you so much for being with us today.
Thank you for inviting me.
Well, we are very excited about your upcoming presentation, but before we talk about that, perhaps you can tell us a little bit about yourself and why the topic of neonatal abstinence syndrome has become such an area of passion for you.
Well, to start off, I've been in neonatal nursing since 1971, and I became interested in neonatal abstinence syndrome during my PhD program when I was at the University of Washington in Seattle. And at that time, I went into the program with the idea that I was going to develop a pain scale that we could use in our premature infant population. However, in talking with my committee and looking specifically at babies with neonatal abstinence syndrome, not very much had been done with that population. And really, the thing that I realized in working with these babies and with the staff nurses as I was preparing my dissertation, which was to look at the use of a mechanical rocking bed to decrease signs of withdrawal in babies who were intrauterine exposed to drugs, I found that the nurses were not very accurate in assessing babies for signs of withdrawal, and that really is problematic because the severity of the sign is very much dependent upon how the baby is medicated for their withdrawal signs. So at that time, I really got into the literature and became very involved with developing an inter-observer reliability program for the staff nurses so that I could be assured that in my study I had an accurate neonatal abstinence assessment score, which then could be used accurately to identify babies that required treatment for their signs of withdrawal.
Oh, that sounds fascinating. And, you've been, in the NICU for a while now, and I'm really curious. I'm sure that you've seen a lot of changes through the years. And what do you feel are the biggest myths surrounding neonatal abstinence syndrome?
Well, I think the biggest myth is that these babies are born addicted to drugs. And we have to remember that these babies are not born addicted to drugs. They're passively exposed to drugs that the mother consumed during their pregnancy. So we need to get away from the negativism that's associated with substance use and abuse. So I would like people to really understand that these babies are not drug addicted, that they do have exposure intrauterine. So we need to get away from calling them drug addicted babies.
That seems like such an important point. And do you find that in terms of caring for the mothers of these babies, I assume that negativity is a big issue as well. Do you find that?
Oh, absolutely, absolutely. And I think part of that reason is we as healthcare professionals, we really weren't taught about substance exposure and substance misuse during our educational programs. So I don't think in general nurses as well as physicians have a good understanding of what addiction is and that it really is a disease. And it doesn't mean that a person doesn't have willpower, etc. These women do know that the drugs that they're taking during their pregnancy can harm their baby. They know their babies will have some signs of withdrawal. However, many of these women need to stay in a methadone treatment program or a buprenorphine treatment program for opioid addiction because it helps them live a normal life. So the babies will probably have signs of withdrawal. However, it's something that we can treat and manage, and these babies can go home without any additional signs of withdrawal. So we can handle the problem very easily. We just need to have a better understanding of what addiction is, that it is a disease, and that these women do care about their babies, and they are doing the very best that they can.
Okay, thank you for that. I think that's, so interesting and such an important point. And I think often, there is kind of quite a stigma surrounding drug addiction, and as healthcare providers, it's so important for us to be educated on that. So really looking forward to learning more about all of this in your presentation. Perhaps you can tell us a little bit about what you hope delegates will be able to take away from your presentation and take back to their practices.
Well, I think the most important thing is to remember that these babies are not addicted to drugs. The other thing is for us to remember that addiction is a disease and it is treatable. And we also need to understand that there are some women who have had a problem with addiction for their whole lifetime. And as a result, there are chemical changes that occur in the brain. So as a result, they may need to maintain on some kind of an opioid maintenance therapy program for the rest of their life. And this is not a negativism. And really, we should be asking women about their treatment program, how well they're doing in their treatment program, and ask them if there's anything that we can do to help facilitate their success in their treatment program.
Okay, that's wonderful. I think that probably makes a big difference for a lot of these women. You know, the way that we treat them and the way we approach the situation has such a huge impact on them.
That's very true.
Okay, well, thank you so much, Karen, for taking the time to chat with us today. For our delegates who are listening, you can learn more about all of this from Karen on Monday, October 17th at 1500 UTC. Feel free to visit our website at goldperinatal.com to check out all of the information and to figure out what time the presentation is at in your own time zone. And we look forward to seeing you then. Thanks so much, everyone. Bye for now.